Hello everyone, in this video we are going to discuss about external features of the spinal cord. Now here you can see a brain with its covering is continuous with the spinal cord with its covering. Okay, so the medulla oblongata is continuous with spinal cord. See this, and everything is covered by meninges. Now if we talk about the spinal cord only, then in an adult the length of spinal cord is on an average 45 centimeters, and particularly in adult male, and in adult female it is approximately 42 centimeters, that is 18 each, and the average weight in adult is around 30 grams. Okay, now as you know, spinal cord is providing attachment to spinal nerves on either side. So total there are 31 pairs of spinal nerves attached on either side of the spinal cord throughout the length. Out of this, 8 are cervical, 12 pairs are thoracic, 5 pairs are lumbar, 5 sacral and 1 coccygeal. Now if we see it closely, see this is how it looks like, almost similar like medulla. And beyond foramen magnum it is termed as spinal cord. Now this is derived from the caudal part of the neural tube, which remains rudimentary, and this assumes a tubular structure which is having a canal inside or cavity inside, which is termed as central canal, and that is lined by ependyma and filled with CSF. So that cavity of spinal cord is continuous above with cavity of the hindbrain, that is fourth ventricle. Now on either side you can see multiple rootlets are attached. Now these are nothing but rootlets of dorsal and ventral roots, which will get unite to form corresponding spinal nerves, and these spinal nerves will emerge out from corresponding intervertebral foramina. Now at the caudal end, let me show you, the spinal cord turns out to a truncated cone shaped structure. Now this is termed as conus medullaris. See this. This is a truncated cone shaped structure, and its continuation is a thread like filamentous extension of pia mater. This is termed as phylum terminale. Now what is the extent of conus medullaris, or we can say what is the extent of spinal cord? So up to 3rd month of intrauterine life, the spinal cord extends throughout the length of vertebral column. Later on, due to disproportionate growth of the vertebral column and spinal cord, obviously the vertebral column will grow faster as compared to the underlying spinal cord. The conus medullaris assumes higher and higher position. So at the time of birth, in newborn, this conus medullaris is situated against the body of L3, and in an adult this terminates at lower end of L1 or disc between L1 and L2. Let me show you. So this is a spine, and this is L5, L4, L3. So against the body of L3 in newborn the spinal cord terminates, and this is L2 and L1. So at lower border of L1, at this point or this between L1 and L2, there will be conus medullaris in case of adult. Okay, now if you see it from behind, this is the spine of L1. So below over here at this level the spinal cord terminates. And as you know, a process called as, or a procedure called as lumbar puncture is generally carried out one vertebral level below. So at the level of L3 or disc between L3 and L4. Okay, somewhere over here the needle is inserted to reach into the vertebral canal. So below L1, in this canal, in the vertebral canal, there is no spinal cord, only remaining spinal nerves are found, and there is no chance of injuring the spinal cord. See this, the probe is seen in the vertebral canal, okay, between L3 and L4. So this is the level of doing lumbar puncture in case of adult. In case of pediatric patient or in newborn, still one vertebral level below. For safety purpose, the lumbar puncture is carried out. Now let's observe the spinal cord closely. If we see it as a section, okay, let me show you, let me zoom in. Just see the section. So in this section, what you can see is in the center there is an H-shaped area or butterfly shaped area. This is the gray matter and it is surrounded by white matter. Ventrally you can see Antromedian Fissure, which is deep inside. See this, there is a covering of pia mater as well, but this is Antromedian Fissure. Posteriorly will be posteromedian sulcus, and on either side you will get two anterolateral and posterolateral sulci. So that we will discuss in a diagram, but it is just to show you how a cross section of spinal cord looks like. Similarly, when you see it from in front, see this, multiple small nerve rootlets are emerging out. Okay, see, these are the rootlets. Similarly, along the posterior side also you will see multiple rootlets emerging out. See this, multiple rootlets, and these rootlets will form the spinal nerve after joining to form the roots. Okay, so there are ventral root and dorsal roots, and this roots will join to form spinal nerve, which will emerge out from intervertebral foramen. Now individual segment or a portion of spinal cord which provides attachment to a single spinal nerve. Okay, the number of rootlets attached to a particular segment of spinal cord which turns into a spinal nerve, that particular part is termed as spinal segment. Now as you know, there are 31 pairs of spinal nerves, so obviously there will be 31 such spinal segments. See this. This is termed as spinal segment. Okay, the thickness varies from region to region. They are having highest thickness in thoracic region, and they get crumbled in the lower thoracic or lumbar region, particularly at L1. See this. Now if you see it from above, you can clearly make out there are rootlets. These are dorsal rootlets. Okay, and these are the ventral rootlets. Okay, and along the dorsal rootlets you will find dorsal root ganglion. Again, this we will discuss in a diagram, but just imagine the thickness. This is the dorsal root ganglion. Okay, these are dorsal rootlets, and these two together will join to form a spinal nerve. As soon as the spinal nerve emerges out from intervertebral foramen, it will divide into ventral and dorsal primary ramus. So now again you can see in the center butterfly shaped gray matter. Now as I told you, the vertebrae will not coincide with this spinal segment because the length of both spinal cord and vertebral column are not same. So we need to understand at which vertebral level exactly deep inside which spinal segment is situated. So in cervical region, the formula is you'll have to add +1. Suppose you are palpating spine of 4th cervical vertebra and you want to know the underlying spinal segment, then you'll have to add 1. So like there lies 5th cervical spinal segment. Okay, then in upper thoracic region you'll have to add 2, that is +2 to the spine. In lower thoracic you'll have to add 3, +3 to the level of spine. Particularly at the level of T11, if you are palpating 11th thoracic spine, then you will have to add +4. So which spinal segment lies deep inside? That is 3rd lumbar. Then against the spine of T12, you will have to add +6. So there will be 1st sacral spinal segment deep to the T12, and at L1, as we have discussed, the spinal cord will terminate. Now throughout the course, the thickness of the spinal cord will not remain static. It is actually tapering down gradually, but at particularly two regions, at cervicothoracic region and at lumbosacral region, there are two enlargements, particularly from C4 to T2 spinal segments, and from L2 to S3 there is an enlargement at both the places. Now why there is an enlargement? It is to accommodate extra nerve fibers which are meant to supply the girdles and limb. So in cervicothoracic enlargement there are extra fibers which are meant to supply the pectoral girdle and upper limb, and similarly the lumbosacral enlargement is meant to accommodate extra fibers which are supplying pelvic girdle and lower limb. Now as we have discussed that spinal cord in adult will terminate at the level of L1 in the form of conus medullaris. So what will happen to the spinal nerves beyond that point? Now you can see this is a bunch of spinal nerves. Okay, actually 10 pairs of spinal nerves. So beyond L1 the remaining 4 lumbar, 5 sacral and first coccygeal spinal nerves and their pairs will be lying within the vertebral canal. Okay, and these 10 pair of spinal nerves together will give an appearance of a tail of an horse. This is termed as chorda equina. So this is chorda equina, bunch of nerves. Okay, 10 pair of spinal nerves. And let me separate all this. Okay, this is the termination of spinal cord. See this. Okay, here will be the conus medullaris. So these are all nerves forming chorda equina. See this. Okay, I am separating these nerves. And as we have discussed, beyond there is a phylum terminale. So with that you can identify the phylum terminale. See, this is the phylum terminale, and remaining will be the spinal nerves, chorda equina. This everything will remain in vertebral canal, and at their corresponding intervertebral foramina these nerves will leave the vertebral canal. Okay, so this is conus medullaris, phylum terminale, and these are all chorda equina. Now let's discuss this section of spinal cord in a diagram. So in this diagram it is to show you the cross section of the spinal cord, and in the center is the H-shaped gray matter and periphery is having white matter. Now when we see the spinal cord externally, along the anterior aspect in the midline there is a fissure. This is termed as Antromedian Fissure, which is anteriorly oriented, which is continuous and which is very deep inside. So it extends up to considerable depth into the substance of spinal cord. Similarly, posteriorly there is posteromedian sulcus, which is quite shallower as compared to the anterior one, but it sends a septum deep inside that is made up of neuroglial tissue, and that along with this anterior one, these two together will divide the spinal cord into two equal halves. So that you can clearly make out. So this is termed as posteromedian septum, this is termed as posteromedian sulcus, and this one is antromedian fissure. Similarly, on either side there are two faint sulci. These are termed as anterolateral sulci. You can clearly make out, and along this anterolateral sulci small rootlets which will unite to form a root. So that actually provides attachment to this ventral roots via rootlets. Similarly, on either side of the midline posteriorly there are two faint sulci. These are termed as posterolateral sulci, and this will again provide attachment to this dorsal root. Actually this dorsal root is having two divisions, medial and lateral, but it is shown only one. But just understand that this posterolateral sulcus will provide attachment to dorsal root, and these two roots, dorsal root and ventral root, they unite to form spinal nerve. Now near its termination the dorsal root shows a bulge. Now this bulge is lodging a ganglion inside, that is termed as dorsal root ganglion, and it contains pseudo-unipolar type of the neurons. Now the location of this ganglion is nearer to the intervertebral foramen or almost at the foramen, and as soon as the nerve is formed, the spinal nerve is formed, it will divide into ventral primary rami and dorsal primary rami. That is a plural form. You can say ventral and dorsal primary ramus. Now you know the ventral primary rami throughout in our body will form various nerve plexuses like cervical plexus, brachial plexus, lumbar plexus, etc. So this is the ventral primary rami. Now talking about the spinal cord itself, these three sulci, anterolateral sulci, posterolateral sulci, and anterior and posterior median fissure or sulci will divide the white matter into three: anterior, lateral, and posterior parts. These are termed as anterior funiculus, lateral funiculus, and posterior funiculus, and these are lodging their corresponding tracts. Now in cervical region and upper thoracic region, in the posterior funiculi on either side, there lies another septum, or we can say another division. This is termed as postero-intermediate septum, and that will further divide individual posterior funiculus into medial and lateral parts. So by and large, this is how the white matter is divided. As we have discussed, the grey matter is H-shaped or butterfly shaped, and it is having ventral horn and dorsal horn. There is a connection in the midline of both the sided grey matter, and in the center there is a central canal which is lined by ependyma, and that is filled by CSF. Now in thoracolumbar region, from T1 to L2, there is an additional lateral horn, you can see over here, and that lodges preganglionic neurons or cell bodies of preganglionic neurons of sympathetic nervous system. Similarly, in S2, S3 and S4 segments, if we take sections of S2, S3 and S4, then again we will get this lateral horns that will contain preganglionic neurons of parasympathetic system. So for parasympathetic, the craniosacral outflow, from craniosacral outflow, the S2, S3, S4 sacral outflow belongs to this lateral horn. Similarly, for sympathetic, the thoracolumbar outflow is seen in the form of preganglionic neurons situated in lateral horns. So over here in this diagram, only one-sided ventral root, dorsal root ganglion, and formation of spinal nerve are shown. But if you imagine it along the other side also, then this entire thing, okay, for up to formation of spinal nerve, this entire thing along with the meningeal coverings, this entire thing is situated within the vertebral canal. Now regarding meninges or the coverings of the spinal cord, the same three meninges, Dura Mater, Arachnoid Mater and Pia Mater, are continuous from the brain to cover the spinal cord within the vertebral canal. Over here you can see this is the Dura Mater, and its continuation is the Dura Mater covering the spinal cord. See this, it's very tough fibrous structure, and it covers, supports and protects the delicate spinal cord. But it is different from the cranial dura, as it is having only single layer, that is meningeal layer of Dura Mater. There is no endosteal layer of dura like cranial dura, and so as there is a space in between the vertebral canal and the Dura Mater, that is termed as epidural space, the space between vertebral canal and Dura Mater or spinal dura, and that is having neuroglial tissue, some fat and internal vertebral venous plexus that drains the blood from the spinal cord. and deep to the dura there is an arachnoid mater, which is transparent thin avascular structure, and the space between arachnoid mater and dura mater is termed as subdural space, that is having a capillary film of fluid. Deep to the arachnoid mater is the pia mater, the same pia mater which is continuous from the brain, and that lines all the irregular or all the surfaces of the spinal cord, that is spinal pia mater, and this is also providing a medium for the blood vessels to reach to the spinal cord, and for giving support to the spinal cord it divides or it modifies to form 4 different parts. These are termed as the phylum terminale that we have discussed. It is a thread like filamentous structure, non-nervous tissue, and this is phylum terminale. Now the dura mater and arachnoid mater will terminate at the level of S2 vertebra. So up to that point this pia mater is situated within the dura and arachnoid. Okay, but beyond that point, beyond S2, this pia mater has to traverse the dura and arachnoid, and it will reach up to the posterior surface of first coccygeal vertebrae. Over here you can see, okay, CO1, and here it terminates. So on an average length of pia mater or phylum terminale is 20 cm. First 15 cm up to S2, from L1 to S2 is termed as phylum terminale internum, which is lying within the dura and arachnoid, and beyond S2 up to CO1 remaining 5 cm is termed as phylum terminale externum. Initial 4 to 5 mm of phylum terminale may contain extension of the central canal and may contain CSF. Then that extension of central canal containing CSF is termed as terminal ventricle. So the first extension or first modification of pia mater is phylum terminale. Second one is sagittal septum like structure situated along the ventral aspect within the Antromedian fissure, and that forms a sagittal septum which holds the spinal cord from in front, that is termed as linea splendens, and similar septum is found along the dorsal aspect, which is another sagittal septum which may be perforated, that holds the spinal cord from behind, and that is termed as subarachnoid septum. So in front, particularly in lower part of the spinal cord, there is linea splendens, and behind in the midline there is subarachnoid septum. Below is phylum terminale, and on either side there are tooth-like expansions of the pia mater. These are termed as ligamentum denticulata. Now these are 21 pair of ribbon-like extensions of the pia mater. Let me show you. See, this is one of the extension you can see, or one of the ligamentum denticulatum. See this one. Okay, so there are such 21 pair of ligamentum denticulata. The first one is attached at the margin of foramen magnum between fourth part of vertebral artery in front and spinal root of accessory nerve behind, and the 21st pair of these ligamentum denticulata are found between T12 and L1, 12th thoracic spinal nerve and first lumbar spinal nerve. Now these are providing anchor to the spinal cord along the sides. See this. This is one ligamentum denticulatum, a triangular ribbon-like expansion. Okay. See this. This is on another side. You can make out over here. It's very thin, so it gets torn while we are cutting the dura to separate the attachments. See this. You can see the shiny structure. These are ligamentum denticulata, and particularly the 21st pair of this ligamentum denticulatum, as we have discussed, it is situated between T12 and L1. It is having a fork-like expansion. Okay, rest of the denticulata are ribbon-like triangular expansion, but the 21st is fork-like and the fork is directed downward. So in neurosurgery, it gives an idea about the orientation of respective spinal nerves and orientation of spinal segment. Now let's discuss blood supply of the spinal cord in a diagram. So here in this diagram, it is to show you the arterial supply of spinal cord. This is ventral aspect and this is dorsal aspect. Now over here, this is basilar artery, which is formed by both the sided fourth part of vertebral arteries, and this vertebral arteries will give anterior spinal arteries, which will merge in the midline to form a single anterior spinal artery. But this single anterior spinal artery will not able to supply the entire length of the ventral aspect of the spinal cord. So it can supply only up to upper 1/3 or maximum up to cervical region. Beyond that, we need some reinforcement. So over here you can see multiple additional arteries are giving branches, and these are forming a continuous anterior arterial trunk. So that continues as anterior spinal artery, particularly from lower cervical region to the rest of the length of the spinal cord. Now, how this reinforcement occurs? These are nothing but the arteries related to the vertebral column, like deep cervical artery, ascending cervical artery, posterior intercostal arteries, lumbar arteries, lateral sacral arteries. Now at regular intervals, the segmental branches, these are termed as segmental branches, will traverse through intervertebral foramina, and they will divide into anterior and posterior radicular branches, and these radicular branches will merge to form a continuous single anterior arterial trunk, and this will reinforce the smaller size anterior spinal artery, and this is how the ventral aspect of the spinal cord is supplied. Now particularly in the lower thoracic region, somewhere over here, particularly in certain books it is mentioned at the level of T11, the segmental artery is very large, and then it is termed as Arteria Redicularis Magna, and that Arteria Redicularis Magna, or it is also termed as artery of Adam-Kivix, is supplying almost lower 2/3 of ventral aspect of the spinal cord. So this is how via multiple arteries the anterior spinal artery gets reinforced. Similarly, if you see the posterior part, the fourth part of vertebral artery, or sometimes from posterior inferior cerebellar arteries, two posterior spinal arteries are given, and again like from the segmental arteries, similar reinforcement occurs for the posterior spinal arteries. So instead of one single anterior spinal artery, here forms two posterior spinal arteries. They are related to the dorsal roots, and at regular interval the reinforcement occurs. At places this single posterior spinal arteries will give collateral branches, so by and large there forms total 4 such posterior spinal arteries in relation to the dorsal roots, and they are reinforced by these segmental arteries and posterior radicular arteries. So this is how the posterior aspect of the spinal cord is supplied. Now let's see how each segmental arteries are reaching to the spinal cord and how they supply. So here in this diagram, just imagine if it is a posterior intercostal artery which is giving a segmental artery, and that divides into anterior and posterior radicular arteries. These are radicular arteries, and here you can see in diagram they give multiple branches, and they will reinforce the anterior spinal artery and two posterior spinal arteries in relation to the dorsal root. So by and large there is formation of 5 such arterial trunks along the entire length of spinal cord. Now over here you can clearly make out this is anterior spinal artery in relation to the Antromedian Fissure, and this will give central branches. See this. Now these central branches are 5 to 7 in number at every 1 centimeter thickness of spinal cord. So at every 1 centimeter, if you consider entire length of the spinal cord 45 centimeter, so at every 1 centimeter such 5 to 7 central branches of anterior spinal artery are given, and they will supply ventral 2/3 of the cross section of spinal cord. See this dotted line is suggestive of ventral 2/3 and dorsal 1/3. So dorsal 1/3 section is supplied by these posterior spinal arteries by their central branches. Now one thing very important to know is these central arteries which are entering within white matter or gray matter, they will not anastomose with each other. Okay, except capillary levels there is no connection. So these central branches are an example of end arteries. Now the collateral branches of this posterior spinal and anterior spinal, they form a continuous pial plexus, or we can say arteria corona or vasa corona. So there is a continuous such circular arterial plexus is formed throughout the length. That is termed as vasa corona or arteria corona. So this is how the spinal cord receives its arterial supply. Unlike arterial trunks which are 5 in number, the venous drainage occurs via these 6 longitudinal venous trunks. One antromedian, second posteromedian, 2 anterolateral and 2 posterolateral venous trunks, and they will drain the blood from spinal cord to the internal vertebral venous plexus. They are also in connection with basilar venous plexus in upper part. So similar thing here you can appreciate, that is what we have discussed in diagram, the ventral longitudinal venous trunk. See this. So this is how it is oriented. Now this is to show you an orientation about how spinal cord is related to the vertebral column. So now we can clearly make out this is the conus medullaris, phylum terminale, chorda equina. Okay, and this will be the L1 because the conus medullaris is situated at the lower border of L1. So L1, 2, 3, 4 and 5. So along with the respective intervertebral foramina, you can see from the side this chorda equina will emerge out beyond L1. Okay, so this is how deep inside it is oriented. So this is regarding external features of the spinal cord. Hope you understood well. Thanks for watching.